Did you know the first 1 month after having hip replacement surgery is the most crucial time of recovery, as doing physical therapy in that first month is not only going to retrain your body of how to do these movements and activities that now you have to relearn, but it's also going to teach you how to make sure you're not compensating with your other leg or with other parts of your body so that you can prevent future injuries from occurring. I'm Matt Sigwa, a doctor of physical therapy, and in this video, I'm going to be discussing what normal recovery typically looks like in the first 1 month after having hip replacement surgery. I'm going to be discussing the normal symptoms, function, which assistive devices that are going to be used, and all that other good stuff that comes with recovery. So before we get into the video, please hit that subscribe button to support the channel so you can see more videos just like this one. Now, let's get started. All right, so at the 1 month mark, in regards to your symptoms, this is the time when most patients are seeing the benefit of having that total joint replacement in the hip. So related to pain, most patients are saying that the pain is essentially 0 to very minimal, especially in standing or walking positions. They're able to tolerate those positions a lot better, and some even notice not having any pain at all. For swelling, at the 1 month mark, typically it's going to be on the very minimal side to almost barely noticeable. As long as you're working on the elevation and the icing, swelling by 4 weeks is essentially gone. Now, for the individuals who weren't able to stay super consistent with elevating and icing and or more prone to just having more inflammation, then they'll see a little bit more moderate swelling and edema around the hip. But for the most part, for most people, swelling should be on the minimal side at 1 month mark. For bruising, unless you're one of those individuals who bruise easily and bruises take a lot longer to disappear and fade, usually at the 1 month mark, bruises are all gone and faded away completely. For the assisted devices, so walkers and canes, it's going to really depend on how strong you were going into the surgery. So if you were pretty fit, or if you did exercise or physical therapy prior and you didn't need assist device, so no walker, no cane prior to the surgery, then usually by that 1 month after a hip replacement surgery, most people, they're either using a cane or they're using no assisted device at all. So of course, you're going to be required to have your physical therapist or your surgeon clear you from discharging a specific assisted device, especially going from a cane to nothing at all. You're going to have to be cleared to do so. Otherwise, you may risk inflaming that hip or increase fall risk if you discharge an assisted device on your own too soon. But if you weren't using an assisted device prior to the surgery, usually by that 1 month mark, you're not using anything, not even a cane, unless it's for like a very long walk. So if you're doing like walking in the mall, or maybe even like Costco without a cart, or just any long duration of walking. So that's usually going to be like a 30-minute walk. That's not super common to have someone walking for 30 minutes without a cane. But in terms of day-to-day activities and small walks in the community or in small stores, then usually most people at the 1 month mark are able to walk just fine without a cane. So one of the questions I get asked about the most is, when can you return to driving after the hip replacement? So that 1 month mark is typically a guideline that a lot of surgeons and doctors use. So 4 to 8 weeks is when they'll generally recommend returning back to driving. But that's obviously going to depend on your pain and function, your range of motion and mobility in that hip, as well as being discharged from certain medications. There are some prescription medications that you want to typically avoid driving when you're using those. But it's also going to depend on whether you had your left versus your right side in terms of that hip replacement. So returning to driving is going to be a lot sooner for that left leg, and you're going to be more limited based on any prescription medications that limit you from driving. Now, with the right hip replacement, which is more of the concern when it comes to driving, because you need a certain amount of strength, endurance, range of motion for that hip. Typically, we like to wait until 4 weeks. So at that 1 month mark, if you have those criteria that we talked about, in terms of physical capabilities, then that's generally when we'll tell you that, okay, you can start short driving, short distance, so you're not doing anything like 30 1-hour drives, those longer commutes. But usually at that 1 month mark is when you'll see most patients return to driving. Now, obviously, some patients will try to return to driving sooner. That's all going to depend on their physical function, like we talked about. But general rule of thumb is usually after 4 weeks, or that 1 month mark, is when patients will start to drive. And in regards to your daily function, so getting in and out the bed, getting in and out from the couch, the toilet seat, doing stairs, all those things at this point for the 1 month mark should be pretty independent. So you're not going to be needing someone physically to help you with any of those movements. At this point, you should have learned the techniques of how to do those transfers safely and efficiently to where you're not relying on external physical help. Now, with the stairs at the 1 month mark, you might still be doing that step 2 pattern versus alternating each step. So that's all going to depend on your pain tolerance, how your pain is progressing at that 1 month mark, and also how your single leg strength and stability is, and if it allows you to essentially do reciprocal or alternating walking up or down the stairs. But in general, you should be able to do that modified version of the stairs. But all of those transfers, all those functional activities should be independent in terms of how you're doing them. You shouldn't need any assistance at the 1 month mark. Now, in terms of exercises, at the 1 month mark, typically most patients are discharged from their home and are starting some kind of outpatient physical therapy where you're in a clinic working with a physical therapist on different exercises and working on regaining more range of motion. Now, a lot of the exercises typically at that point will focus more on standing, balance. You're working on some single leg exercises when it is appropriate. If you're having some deficits still, then they're going to be working on a lot of single leg exercises, whether that's in a sitting, lying down, sideline position, just to make sure you address any of those asymmetries, so that they can get you to as balanced and symmetrical strength and range of motion for not only the hip, but for the knee joint, for the ankle joint, so that you don't have those long occurring imbalances, whether that come from the muscle deficits or muscle lengths. So the earlier you're able to get into physical therapy in terms of the clinic, the better your outcome is going to be. So let's say if you get discharged from like home health physical therapy after 2 to 3 weeks of in-home therapy, you generally don't want to take too much time in between. Like essentially starting the week after is ideal. You don't want to go 2 to 3 weeks of not having physical therapy and starting your outpatient clinic. But in terms of the exercises, they're going to be a little bit more demanding, but you can definitely expect to work on more functional activities just so you can gain a lot more confidence with your ability to stand on one leg. So for example, when you're doing the stairs and you're doing the normal way where you're alternating left and right, there's going to be that moment where you're spending more time on that one leg, especially if you're not holding onto the railing. Obviously, it's best practice just to hold on to the railing no matter what, but you want to get back to alternating in more normal walking patterns and movements. So physical therapy will be started in the clinic typically at 1 month.